Can I start?
Yes.
Assalamu alaikum, everyone. Welcome to the very last episode of paper presentation competition arranged by Axis Dental School, the largest online platform for sharing and gaining knowledge. It is my pleasure to tell you that we have successfully completed all 15 episodes of this competition. And today we are gathered here to join the last and 16th episode of this competition. And the name of this group is UNC 15, and the topic is amazing topic, dental implant. UNC 15, this name came from the UNC 15 periodontal probe, which is preferred in use of clinical research if conventional probes are required. The naming of this group came from this UNC 15 periodontal probe. I would like to thank our honorable mentor and our president of Axis Dental School, Dr. Farhadul Islam Bhaiya, and our respected mentor and advisor, Dr. Anupam Podder sir, for mentoring us for this amazing journey. I would like to welcome our honorable for this program, Professor Dr. Muhammad Abul Kalam Joarder sir, President of Bangladesh Periodontology Society and ex-head of the Department of Periodontology and Oral Pathology, Dhaka Dental College. I would like to name our honorable guests for today. Our guest, Dr. Muhammad Ahamedul Kabir Milon sir, BDS, DDC, PhD, Periodontology, Japan, Assistant Professor, Department of Periodontology and Oral Pathology, Bangladesh Dental College. Joint Secretary, BPS. And our second guest is Professor Dr. Muhammad Zahid hossain sir, Division of Periodontology, Department of Preventive Dental Science, Nazran University, Saudi Arabia. And I would like to welcome our advisor, Dr. Anupam Podder sir, Associate Professor and Head of the Department of Periodontology and Oral Pathology, Dhaka Dental College.
Hello.
Yes, sir.
আপনি কি করেন? আপনি যে মানে অডিওটা অন করেন, অডিও অন করেন, অডিও অন করেন, অডিও অন করেন, অডিও হন হন।
Okay.
I would like to welcome our honorable judges for this night. Our judge, Professor Dr. Anirban Chatterjee, ex-vice principal, professor and head of the Department of Periodontics and Implantology, the Oxford Dental College, Hospital and Research Center, Bangalore, India, President and Indian Society Periodontology. Our second judge is Dr. Anurag Satpathy sir, Professor, Department of Periodontics and Oral Implantology, Institute of Dental Sciences, Shiksha O Anusandhan University, Bhubaneswar. And our next judge is Dr. Maisie Eliezer, DMD, MSc, MAS, Periodontology and Implant Dentistry, Bern University, Switzerland. Dr. Fuad Al-Hasnat sir, BDS, DDS, MSc, Associate Professor and Head of the Department of Periodontology and Oral Pathology Department, Mandi Dental College and Hospital, Consultant in Ibn Sina Specialized Dental Center. And our most talented presenters are Muhammad Khalid bin Islam, Session 16-17, City Dental College. Maliha Mehzabin, Session 16-17, Chittagong Medical College, Dental Unit. Khwaja Mohammad Rakib Hassan, Session 16-17, Chattogram International Dental College. In this session, I, Oishi Anjum, session 17-18 from Dhaka Dental College, your moderator throughout this event. I would like to call our Honorable Chairperson, Dr. Joarder sir, to share some words with us. Dr. Joarder sir.
Miss Oishi, Dr. Joarder sir is not in online. His audio is not performed. But you may start with the chair of Professor Dr. Anirban sir.
জর্ডার স্যার আসছে তো দেখেন তো অডিওটা ঠিক আছে কিনা জর্ডার স্যার আসসালামু আলাইকুম
audio ঠিক নাই না
অডিওটা ঠিক হয় স্যার
Okay, I would like to call our honorable guest, Dr. Muhammad Ahamedul Kabir Milon sir, to share some words with us about this event.
Thank you very much, Oishi, today's moderator. I'd like to thank today's chairperson, Professor Abul Joarder sir, and guest, Professor Zahid sir, and our judges, Anirban sir, Anurag Satpati sir, Dr. Meiji Elijah, madam, and today's paper presentation competition advisor, Dr. Anupam Podder, Associate Professor and Head, Department of Periodontology and Oral Pathology, Dhaka Dental College. And I would like to special thanks to Dr. Farad, the President, Axis Dental Schools. Actually, it is first time in Bangladesh a paper presentation in periodontology. For that, today's presentation is the dental implant. It is the very special treatment Bangladesh, and recently it is very famous in Bangladesh. Actually, I would like to thank the Axis Dental School. They are organizing this type of program. So thank you very much, Oishi and Jum.
Thank you, sir. Thank you so much, sir, for sharing some words with us. Thank you, sir. Now I would like to call Dr. Anupam Podder, sir, our honorable advisor.
Thank you, Oishi Anjum, the student of third page of Dhaka Dental College, 17-18 session, for your nice moderation. Honorable Chairperson of today's session, Professor Dr. Abul Kalam Joarder sir. Probably she did not enter in our session due to his audio problem, and I would like to welcome our guest, Professor Dr. Zahid, who is the Professor of Division of Periodontics, Department of Preventive Dental Science, Nazran University, Saudi Arabia. Maybe he's now with us. He has a program. He may be joined with us in next sometimes later on. And thanks, welcome our Joint Secretary of BPS, Dr. Ahamedul Milon, and our Honourable Judges, Professor Dr. Anirban sir, the ex-Vice Principal and Departmental Head, Oxford Dental College, Bangalore, India, and our another judges, Professor Dr. Anurag Satpathy sir, Department of Periodontics and Oral Implantology, Institute of Dental Science, Fixture, Nazran University, Bhubaneswar, India, and our most important another judges, Dr. Md, ma'am, DMD, MSc, MAS, Periodontology and Implant Dentistry, Bern University, Switzerland. And another judges, Dr. Fuad Al-Hasnat, is the head Department of Periodontology and Oral Pathology, Main Dental College, Bangladesh. Today's topic is dental implant. This is the most important topic in dentistry. Although it is neglected in our country, but it is, we were trying to encourage our student, our general dentist, and our general people to awareness about dental implant. And our today's group name is UNC 15, and today's presenters are Muhammad Khalid bin Islam, City Dental College. He's the batch 2016-2017. Khaza Muhammad Rakib Hassan, come from Mendi Dental College 2016-2017, and also Malia Mahajabin, Chattogram Medical College Dental Unit 2016 and 2017. Today's group is UNC 15, and I would like to thank the FC Dental School platform who do this nice event. This is the 16th event, and this is the final event of the this episode. I hope this episode is helpful to our students who are in the third phase BD student. That means fourth year BD student. They enjoy this session, and maybe they encourage about the periodontology, and and I would like to thank our organizer, the Exit Dental School platform, and his event management team who doing the type of amazing program from last 2 months. It is very much interesting and very much enjoyable to us. So see you again. Our next program will be the result of the result session. It will be held within short period of time. I would like to thank all of you, all of today's guests and today's presenter, and also today's moderator and today's event management team. Thank you all.
Thank you so much, sir. Thank you for sharing some words with us, and
Dr. Oshi,
thank you, Anirban.
Oshi, sir,
Yes, sir.
Oshi. Yeah, our chairperson,
Yes.
Professor Dr. Abul Kalam Joarder
Chairperson.
sir. Abul Kalam Joarder sir is now in.
Yes, sir.
Please send me.
Now with us.
Yeah. You please give time to him to say something about this program.
I have a headphone in the front, I think. Other headphone.
Okay, sir. Now I would like to welcome our honorable chairperson for this session, Professor Dr. Muhammad Abul Kalam Joarder, sir, President, Bangladesh Periodontology Society and ex-head of the Department of Periodontology and Oral Pathology, Dhaka Dental College. Dr. Professor Muhammad Abul Kalam Joarder, sir, can you please share some words with us?
Front.
Thank you. Now, initially, we had no scope on implantology. So at our time, it was very much expensive, say about 3 and 3.5 lakh Dhaka. Now it is, I know, quite reasonable, and we are doing here. I am most happy with we include or only classified with degree Dr. Abdullah Al-Mamun Khan. He has been trained from Germany, and he is a well person in implantology. So I could not see him. Anyway, we have so many apprentice implantologists. Now we come to know from them about implantology. Before that, I want to say implantology is very much associated with periodontology because it needs attachment, bony attachment, and soft tissue attachment. So for care, we are the person to maintain the well-formed implantology. Now, new speaker, I want to hear from them. Please start one.
Thank you so much, Professor Dr. Abul Kalam Joarder, sir, for sharing your valuable words with us. And I would like to start our program today with the words of Dr. Abul Kalam Joarder, sir. I would like to call our first presenter, Mohammad Khalid bin Islam, session 1617, City Dental College, to show his presentation. Khalid bin Islam. Okay, I guess he is just joining us. I would like to call our second presenter, Maliha Mehzabin, session 1617, Chittagong Medical College Dental Unit, to show
What about Khalid bin Islam?
her presentation.
What about Khalid bin Islam? Dr. Farad?
I guess, sir, some technical problems is from his side. So,
Okay.
our second presenter, Maliha Mehzabin.
I was the last presenter actually.
Our last presenter, Khwaja Muhammad Rakib Hassan. Can you hear me?
Yes. Assalamu alaikum.
Walaikum
Walaikum
assalam.
Excuse me, sorry for
I have
that. There
I
was
have some technical problem, that is why I interrupt
in my
this
laptop.
meeting.
Okay. Our presenter, Khwaja Muhammad Rakib Hassan. Okay. Can you start your presentation? I guess some technical problems is occurring. Um, our first presenter, Khalid bin Islam, are you there? Yes.
Yes, I'm
Khalid
there.
bin Islam.
Sorry for late. Sorry for that. There was technical problem in my laptop. I'm very sorry.
Okay, it's okay, Bhaiya.
Thank you, Oshizaman Abul. Assalamu alaikum, honorable judges today. Dr.
Walaikum.
Anupam Podder sir, Professor Dr. Chatterjee sir, and Dr. Meji Eliza madam, and other two judges. And their moderators, fellows, and viewers, good evening. Welcome to my presentation. First of all, I would like to thank Exist Dental School for organizing such a nice knowledge sharing program. I am very much grateful to Exist Dental School to give me the opportunity and makes me part of this great platform of the dental education.
Thank you, Khalid bin Islam. Okay, Khalid bin Islam.
Yes. Now I am sharing my presentation. My presentation is dental implant. Now I am introducing myself. My name is MD Khalid bin Islam. I am from City Dental College. My session is 2016 to 17.
Dr. Khalid, there is a echoing happening. I think you have to close off your mobile. You're in two devices. You open two devices, close off one device.
I want to continue with my mobile. My laptop has a technical problem.
Switch off your laptop then.
Okay, my presentation is dental implant. There is my content. There is my content. Introduction. Yeah. Introduction. Implant. Any object or material such as an alloplastic substance or other tissue which is partially or completely inserted or grafted into the body for therapeutic, diagnostic, and prosthetic or experimental purposes. Implantology, the study or science of placing or restoring dental implant surgery. The phase of implant dentistry concerning the selection, planning, and placement of the implant body and abutment. Dental implant, a prosthetic device of alloplastic material implanted into the wall tissue beneath the mucosa, periosteal layer, and or within the bone to provide retention and support for a removal or fixed prosthesis. Implant prosthodontic, the phase of prosthodontics concerning the replacing of missing teeth or associated structure by restoration that are attached to dental implant. Implant prosthesis. Dental prosthesis such as crown and other fixed dental prosthesis, removable dental prosthesis, as well as maxillofacial prosthesis, supported and retained in part of whole by dental implant. Implant dentistry. The selection, planning, development, placement, and maintenance of restoration using dental implant. Implant abutment, the portion of the dental implant that serves to support and or retain any prosthesis. History of dental implants. The father of modern dental implant, Swedish orthopedic surgeon Pre-Ingvar Brenmark, made his implant discovery in the mid-1960s while researching bone healing. He discovered that bone tissue would fuse to the metal titanium in a process called osteointegration. Components of dental implant. Main components: a fixture, abutment, and substructure. Accessories component: surgical and prosthetic. In surgical, there are two parts: cover screw and gingival format. Prosthetic. Prosthetic has two parts: implant analog and impression post. Main components: implant fixture. The implant fixture is the component that is surgically placed into the bone, also called by implant body, divided into the following parts: body, cast module, and collar. There is a picture. It has three parts: cast module, body, and apex. Now, I would told about abutment. Abutment are the components of the implant system that screw directly into the implant. Abutment eventually support the prosthesis in screw retained restoration, in as much as they accept the retaining screw or prosthesis. For cement retained restoration, abutment may be shaped like a conventional configuration. Classification of abutment. Abutment for fixed prosthesis. 1. Definitive. Definitive have prefabricated and custom made. Prefabricated has two parts: solid abutment and hollow. Hollow has two parts: piece abutment. Now I told about custom-made abutment. The custom-made has two parts: castable abutment, CAD/CAM abutment, and provisional or temporary. Now, I told about abutment for removable prosthesis, overdenture attachment. It has three parts: stud attachment, bar attachment, and magnetic attachment, and telescopic attachment. And now I told about implant superstructure abutment. This is the prosthesis that is fabricated with the support of dental implant. They can be of following types: fixed prosthesis, removable prosthesis, and fixed detachable prosthesis. Fixed prosthesis has two parts: crown and base. Removable prosthesis has overdenture, and fixed detachable prosthesis has hybrid dentures. Now I told about accessories components of dental implant. It has two parts: surgical and prosthetic. Surgical has cover screw and gingival informer. Cover screw is after the surgical placement of implant. A screw is placed in the superior aspect of two-piece implant to cover the connection for abutment during healing period. So also termed as healing screw. During the healing phase, after first stage surgery, a screw is normally placed in superior aspect of the fixture. The screw is usually low in profile to facilitate the suturing of soft tissue in two-stage implant or minimize loading in the one-stage implant. A second-stage surgery, the screw is removed and placed by subsequent component. Now I told about this picture. It has crown screw, implant abutment interface, implant collar, and fixture. Now I told about gingival former. Gingival former is required only for two-stage implant. Following are removed and gingival former, which are available in varying height, are placed on the implant fixture. They extend above the soft tissue into the wall cavity and form a gingival curve around the implant. Usually placed for 2 to 5 weeks, depending on the healing, following which they are removed and impression procedures are commenced. They will be replaced by the abutment in final station, so term as healing abutment or pre-mucous extension. Now, prosthetic has two parts: implant analog and impression copy. Implant analog is a replica of the entire dental implant, not extended for human implantation. This is similar to the implant fixture, but used in the model to fabricate the prosthesis in laboratory. The abutment is fitted to the analog and prosthesis is fabricated in the implant. Impression copy. That component of a dental implant
Khalid
system.
bin Islam, you have 2
Hello?
minutes left.
Okay.
Yes, you have 2 minutes left. Complete.
Okay. Function of component. Implant fixture, body. It goes within bone to provide physical resistance to axial occlusal load and retains the whole structure of implant. A cast module. Portion of fixture that provides a connection to the abutment or attachment. Offers resistance to axial occlusal load and aims to provide a precise fitting for abutment on the fixture. Implant collar allows functional remodeling of bone remote abutment. Fixture interface prevent exposure of surface coating. Abutment. It supports and retains a prosthetic or implant superstructure. Indication of dental implant. Single unit toothless gap with healthy adjacent tooth. When a single tooth is missing, an implant supported crown will preserve the adjacent natural teeth by avoiding the need to prepare them. If the toothless gap is restored with a traditional dental bridge, both adjacent teeth will have to be prepared. This operation involves permanently removing parts of the teeth's original structure, including portions that might still be healthy and structurally sound. Partially eating tulas with that posterior tooth missing. This condition implies the absence of several posterior teeth, molar or premolar, on one or both sides of the dental arch. Kennedy class 1 or Kennedy class 2. Now I told about implant supported prosthesis. Although intending a higher cost, are highly indicated in this clinical situation. Now I told about complete hidden lesion. When all teeth are missing, the only traditional solution available is a full removable denture. Implant supported prosthesis, either fixed or removable, allow to chew the food better, speak more clearly, and they have a superior stability. Other situation when dental implant can be indicated. Patient who cannot tolerate a removable restoration or removable denture, patient with high aesthetic or functional demand. Contraindication for dental implant. Absolute contraindication or relative contraindication. Absolute contraindication has many options. There are severe systemic disorder, osteoporosis, psychiatric disease, psychosis, dysmorphobia, alcoholics, and drugs abuses.
Khalid bin Islam, your time has up and it has over. Like, thank you so much for your presentation. Yes.
I want just 2 minutes for
Okay.
complete my presentation.
Okay.
Advantage of dental implant. To overcome the drawback of removable prosthesis, bone maintenance of height and weight, ideally aesthetic tooth positioning, improve psychological health, increase stability in chewing, increase retention, eliminate need to involve adjacent teeth. Disadvantage of dental implant. It is a surgical procedure which requires a healthy face, may be more expensive than other forms of treatment initially. Then conclusion. Titanium is the most commonly used material for the fabrication of the oral implant. This is supported by favorable mid and long-term clinical outcome. Ceramic implant to satisfy the increasing aesthetic demands and metal-free request of some patients is fraught with compromise. Here there is reference I would follow. Newman, Carranza Clinical Periodontology 10 edition, and postodontic treatment for it into a patient, Jab Bolander. Thank you listening for my presentation. I would like to thank all judges for spending their valuable time with us, and special thanks to Dr. Anupam Podder sir, who always put his helping hand on us. And special thanks to Accidental School for organizing our knowledge sharing program. Thank you. Stay safe, keep smiling.
Thank you. Thank you, Muhammad Khalid bin Islam, for your presentation. Our next presenter is Khwaja Muhammad Rakib Hassan. I would like to call Khwaja Muhammad Rakib Hassan, session 16-17, Mandi Dental College.
Assalamu alaikum.
Walaikum Assalam. Yes, please start your presentation.
Thank you. First of all, I would like to thank you, all of you, sir, and my colleague. And today my topic is dental implant. Good evening. Welcome to my presentations, all of you. Today my content is natural teeth versus dental implant and indication of dental implant and types of dental implant and surgical procedure of dental implant. Now I am going to my slide share.
Is everything okay?
Yes, they're trying to present their slides now. Probably some technical glitches going on. Yeah.
Okay, thank you.
So I am from Mandi Dental College. My name is Khaja Muhammad Rakib Hassan. Hello.
Yeah, please start, Rakib.
Okay. I'm from Mandi Dental College. My name is Khaja Muhammad Rakib Hassan, session 2016-17, batch MD07. Today, my topic is dental implant. And my content is difference between natural teeth and dental implant, and types of dental implant, indications of dental implant, and surgical procedure of dental implant.
Put it as
So-
full screen, full screen. Make it full screen. Slideshow.
Okay, sir.
Slideshow.
Slide. Okay, sir. Give me 2 minutes.
Rakib, are you presenting on a PowerPoint?
So let's back to the point. First of all, difference between natural teeth and dental implant. Natural tooth is the periodontal tissue naturally attaches the bone to the root surface of their teeth. They act as a shock absorber. The gum tissue attached into the root surface, helping to protect the underlying bone. And another one is dental implant. We chose first of all titanium, and the titanium of which most dental implants are made fuses to the new jawbone, giving implant great strength and stability. However, the gum tissue cannot attach to the implants in the same way as they do to tooth roots. Instead, they adhere to them tightly by suction type mechanism. This is the figure of natural tooth and dental implant. One side is natural tooth and another side is dental implant. When placement into the bone soft tissue. This is natural crown. This is implant crown. And this is collagen fiber attachment to the root and implant abutment. And this is collagen fiber attached to the implant. This is root portion of natural teeth and this is implant portion of dental implant. This is gum tissue of natural teeth and this is gum tissue when placement into the bone of implant. This is alveolar bone, the another side is alveolar bone. Okay, let's go to classification or types of dental implant. First one is endogenous, second one is subperiosteal, and third one is transosseous. And also endoosseous subdivided as follows: root from, blade from, ramus frame. And subperiosteal subdivided as follow: complete unilateral circumferential. And last one is transosseous subdivided as follows: staple, single pin, multiple pin. So let's
Khwaja Mohammad Rakib Hassan,
yes, please.
you have 2 minutes remaining.
Okay.
You have 2 minutes remaining.
Let's go to indications of dental implant. Generally, any Edentulous area can be indication for dental implants. Severe morphological compromise of denture supporting areas that significantly undermine denture retention. Poor oral musculature, muscular coordinations, low tolerance of muscular tissue, mucosal tissue, parafunctional habits leading to recurrent and soreness and instability of prosthesis. Active or hyperactive gag reflex elicited by removal prosthesis. Now let's go to the point surgical procedure of dental implant. Basic surgical procedure. First of all, patient preparation. We have to maintain patient preparation, and second one, soft tissue incision. And third one is preparation of dental implant site. And the last one is implant placement. First procedure, preoperative antibiotic prophylaxis is usually recommended. Profound local anesthesia is required for precise implant placement. The patient can rinse within 15 millimeter 0.12% chlorhexidine gluconate for 30 seconds immediately before the start of surgery to reduce the oral microbial count. And preparation of implant site. After the bone is exposed, the surgical guide template is positioned and the preliminary assessment of implant site is made. The residual ridge may have areas of unevenness of sharp ridges that are best reduced with a ringer or bar before drilling for implant placement. Fibrous tissue should also be removed so that it will not be incorporated into the implant site. And another point is several type of incision can be used to gain access to the residual ridge for implant placement. The incision should be designed to allow convenient retraction of the soft tissue for unimpeded implant placement. It should preserve or increase the quantity of attachment tissue and preserve local soft tissue aesthetics. This is the figure.
Your time is up.
Okay.
Raja Mohammad
So,
Rakib Hassan,
I want to 1 minute
your time is over. Okay.
for my quarterly teacher for complete my presentation. So point D, after desired depth and diameter of the recipient site is accomplished, the implant is placed. Although some implants are pressed into place, most are threaded and must be screwed into the place by handpiece at very low speed or by hand. Final tightening is most cases is done by hand with a retouched. After all implants are placed, the wound is closed. Three, post-operative care. We should maintain post-operative care. A radiograph should be taken post-operatively to evaluate the position of implant in relation to adjacent structure such as sinus, inferior, alveolar canal, and relative to the other implants. Patient should be provided analgesics. Patient can also instructed to use 0.12% chlorhexidine gluconate. Rinse or 2 weeks after surgery to keep bacterial populations at a minimum during healing. A patient is evaluated weekly until soft tissue wound healing is complete, approximately 2 to 3 weeks. So thank you. And my reference is Karenja. That's it, my presentation. I would like to thank you, all of you, for being with me. Assalamu alaikum.
Thank you so much, Khwaja Mohammad Rakib Hassan, for your nice presentation. Now, I would like to call our third presenter, Maliha Mehzabin, 16-17 session, Chattogram Medical College Dental Unit. Maliha Mehzabin.
Am I audible?
Yes. You may proceed.
And is my screen visible?
Yes, yes. Your screen is visible.
Okay. Assalamu alaikum. Good evening and welcome everyone. This is Maliha Mehzabin from Chattogram Medical College Dental Unit 2016 and 17 session, 28 BDS from group UNC 15. Today I'm presenting you the presentation on dental implant. But at first, I want to give thanks to Exist Dental School for giving me these opportunities, and our honorable judge and teacher, thank you so much for your valuable time. And I also want to thank Dr. Anupam Podder sir for mentoring us and congratulate all other participants from today. So this is my medical college and this is my dental unit, which is situated in the port city of Bangladesh named Chittagong. You all are cordially invited to my beautiful campus. So these are the contents selected for me today. Introduction, factors considered for dental implants, criteria for successful dental implants, implant biomechanics, criteria of implant failure, factors associated with implant failure, complication of dental implant, and conclusion. So what is dental implant? Shortly, I say a dental implant is a surgical component that interfaces with the bone of jaw to support a dental processes such as crown, bridge, denture, facial processes, or as an orthodontic anchor. So what are the factors considered for dental implants? Biomaterials. We should choose a perfect material which can be commercially pure titanium 99.7%. Then biomechanics. This aspect actually refers from the loading or mechanical forces directly applied on the implants or the other processes. Then dental evaluation. The dentist must evaluate the patient's dental hygiene or oral hygiene and other periodontal disease, any kind of disease. Then medical evaluation consists of any kind of acute illness, terminal illness, or any metabolic disorder, diabetes mellitus, smoking history also can include in this. And then surgical evaluation. All surgeries have risk, we all know. So the surgeon must evaluate the patient's surgical complications like infection, allergic reaction, and etc. Then bone quality. Before implant surgery, that surgeon must evaluate the X-ray and 3D imaging to assess the bone's level and stability and bone's quality, quantity, etc. Heating processes, excessive heating processes can be avoided by low drilling procedures like 2000 RPM revolution per minute, and excessive process heating actually really cause dental implant failure. And the last one is post-insertion maintenance. So what are the criteria for successful dental implant? Criteria for Shintman and Skalman is given 1979. They are the mobility of an implant must be less than 1 millimeter when tested clinically. Then there must be no radiolucency. Bone loss should be less than 1/3 the height of the implants, and there should be absence of infection, damage to structure, or violation of body cavity. And the success rate would be 75% after 5 years. They are quite similar with criteria of Albertson et al. Given 1986, but the success rate after 5 years is 85%, and after 10 years, it is 80%. And the criteria are in individual unattached implant is immobile when tested clinically, no evidence of peri-implant radiolucency. The mean vertical bone loss is less than 0.2 millimeter annually after the first year of service, No persistent pain, neuropathies, paresthesias, infection or violation of the mandibular canal. The patient's and the dentist's satisfaction should be the primary consideration, which is recommended by Smith and Zerf in 1989. So here you can see the implant should be placed a minimum of 2 mm from inferior alveolar canal. And here is a radiograph of successful implant, vertical bone loss after 10 years. Now, what is implant biomechanics? The integration of bone with implant serves as the basis of biomechanical analysis performed for dental implants. Here you can see the implant and bone tissue relation are divided into two types, like osseointegration and fibrointegration. Osseointegration, in case of osseointegration, there is nothing between the bone and the implant, but in case of fibrointegration, there is fibrous layer between bone and the implant. So osseointegration actually a direct structural and functional connection between viable bone and the surface of a load-bearing implant. And the fibrointegration actually soft tissue or periodontal fibers interposed between the implant surface and bone. Now, successful osseointegration is achieved by correct implant shape, limited number of metals, bone growing to contact or almost to contact the implant, absence of periodontal membrane, implant is held tightly by friction and a thin layer of collagen and proteoglycan bone matrix. Here you can see a successful osseointegration and histopathologic section showing the osseointegration between implant and teeth and bone. So previously I mentioned some factors consideration, and whenever they are not properly maintained, dental implant failure can happen. And what are the criteria? Progressive bone loss is greater than half of implant length, increasing mobility, pain or tenderness, uncontrolled exudate. It usually manifests shortly after placement or initial loading. Increased probing depths are often present, and it occurs actually in the maxilla. And what are the causes of integration failure during the healing period? Movements such as from early loading or placement outside the cortex with perforation or dehiscence. And the failure in the longer term is principally from bone loss as a result of excessive loading or peri-implantitis. Excessive loading may result from parafunctional habit like bruxism, or having too few implants to resist normal occlusal forces, or non-axial forces from poorly designed superstructures. Now, excessive loading tends to cause deep angular bone loss around the implant, microfracture of the superficial bone around the implant. Fracture of the implant itself is rare. Here you can see a gross infection around the all types of implant. There is a superperiosteal, subperiosteal implant, in almost all the maxillary alveolus, especially the extensive bone loss here in the left tuberosity. And there are two blade implants in the mandible, bone with bone loss. So peri-implant disease affects approximately 6% of all implant placed, rising to 20% after 10. However, implants can be successful in medullary bone with little cortex. Avascular or sclerotic bone that heals poorly is probably a greater risk. So what are the factors associated with implant failure? Uncontrolled diabetes, which is a systemic factor, then contraindication to surgery, bleeding tendencies, and others. Smoking, which actually delays the healing procedure and make the patient's oral hygiene poor. Then patients prone to osteomyelitis, parafunctional habit, previous radiotherapy to the jaws, previous intravenous bisphosphonate treatment, poor quality bone at site, thin cortex, osteoporosis, active periodontal disease or poor oral hygiene, mucosal disease, high risk patient for infected endocarditis. Now I'll discuss peri-implant complications. First one is peri-implantitis. Plaque-induced inflammation and bone loss around the implant. That means we can see here erythema, bone or bleeding or pain, etc. Infrabony pockets do not develop because there are no contact points, and bone loss is horizontal or forms a broad saucer-shaped defect that affect the entire implant circumferences. Here you can see a peri-implantitis pocketing of pus exudating, and in radiographically you see cylindrical coated implants prone to implantitis, bone loss. Second one is peri-implant mucositis. Peri-implantitis is preceded by it, the equivalent of gingivitis with inflammation limited to the surface. Some degree of mucositis is found in 80% of individuals with implants. This does not progress to bone loss. Then the last one is apical peri-implantitis, which is very rare. This affects approximately 1% to 2% of all implant placed. more commonly in the mandible, apical radiolucency, similar to periapical granuloma. And here you can see same bacteria prevalent can occur peri-implantitis and periodontitis. And here is healthy peri-implant mucosa. This is peri-implant mucositis, and last one is acute peri-implantitis. So what are the complications of implant placement? Incorrect placement can happen, perforation of cortex or hematoma, antral or nasal perforation, and sinusitis can happen in maxillary case of implant placement. Then damage to inferior dental neurovascular bundle, infection that can be acute and chronic, consequent alveolar bone loss, complication of associated surgery, orodental communication following sinus lifting procedure. So quick tips for implant hygiene maintenance: continuing care every 3 months for the first 2 years. Metal scleras are contraindicated. Ultrasonic scleras are to be avoided. Soft rubber cup with toothpaste. Plaque calculus bleeding injuries should be assessed, and oral hygiene instructions should be assessed also. So this is my last picture. I think all of you noticed the missing tooth, not the missing eyebrow at first. And this man's problem can be replaced by our today's topic, dental implant. But we have to consider all the factors I have already mentioned, and we have to be very secured and very knowledgeable about the complication that can happen. So these are the references for today's presentation. And if you have any question now, feel free to ask me. Thank you so much for listening to me, and good night. Thank you.
Thank you, Maliha Mehzabin from Chittagong Medical College Dental Unit for your nice paper presentation. Now I would like to call for our judges for their valuable comments and question and answer session. I would like to call our judge, Dr. Fuad Al Hassanat sir, first to share his valuable knowledge with us and for the question answer with the presenters. Dr. Fuad Al Hassanat sir.
Thank you. Thank you for today's presentation. I thank all of the presenters who were present and tried to present their slides, although they had many technical glitch, except the last one. Thanks to her. She had a very good presentation. Otherwise, we had some problem. But still, I think they tried their level best to present a very good presentation. Regarding dental implant, although this is not very much dental implant are being done in Bangladesh so far. It started in 2000. The first dental implant was placed in 2000. And later on from 2003-04, we have been placing dental implant. Mostly our honorable senior sirs are placing. And nowadays, lots of dentists are placing dental implant. But still, what we know is that dental implant is not as popular as it is in Western countries, developed countries, or in India. But still, people are having knowledge, and we dentists are trying to give knowledge to the students as well as to the patients. So we hope that we can achieve more. And regarding Axis Dental School, this pandemic has created a lot of opportunity, although the students are not being able to go to their institution, but the pandemic and the web, they have created lots of opportunity to learn and flourish their knowledge through the web link. I thank Axis Dental School and the organizers who are behind it. And I also thank Dr. Anupam Podder for arranging this type of program, which will be beneficial for the students so far. For today's topic, dental implant, I myself is also associated with an organization that is the Dental Implant Association of Bangladesh. We are arranging several conferences, also webinars, and also course. So I hope students will learn more from them. And basically, they're for the graduate dentists who can do that. Regarding today's topic, if I say dental implant, this dental implant, so far as I know, was just being incorporated in our syllabus. I mean, undergraduate syllabus, dental implant, periodontal concept of implantology, these are being incorporated for the latest syllabus. Otherwise, when we were students, we never did study dental implant. Even when I was studying in postgraduate training, I came across dental implant, and later on, I had a fascination, and so far we are doing. So my question to Maliha Mezabin, are you there? Yeah.
Yes, sir. Assalamu alaikum.
Thank you. Your presentation was very good. Thanks to you. And you say some of the indications and contraindications and what could be the failure. Do you know the role of periodontist in dental implant?
Thank you so much, sir, for your question. Of course, sir, because we all know the alveolar bone and bone is related with the our dental implant. So a periodontist, of course, must have to check the dental evaluate the patient's oral hygiene and all other things. And there is a relation between the periodontal fiber with the implant also, and that's the main thing of our periodontology, the periodontium and everything. And there is a connection between implant and the periodontium. So we have to know a periodontologist must know the periodontium and periodontal health and everything. And of course, we also know the biological white, which is very important topic in our periodontology. And if the implant can cause any violence there, that will also cause some problems. And also periodontitis and peri-implantitis almost same. They're actually one thing is happens in natural tooth and another is surrounded the implant. So there is a great role can played by periodontologists in the dental implant because all are related.
Thank you. My next question is to Rakib. Can you hear me?
Yes, sir. Yes, sir.
You try to cover the chapters which parts of periodontium and others. Sorry, parts of the implant.
Yes, sir.
Do you know how the parts like which is the abutment, which is the fixture of the implant, and do you know how their structures can differ and what are the effects could be on the bony? Yeah. Can you say something about osseointegration of anything?
Yes. First of all, you asked the question. Thank you. Screw abutment. Yes, sir. I will tell you. This is abutment means mid portion of dental implant and fixture or screw. Screw within the bone when placement of implant or non-living tissue. And another question is osseointegration. Osseointegration means osseous tissue migration into the bone or hello, can you hear me?
Yeah, thank you, Rakib. I got the answer. My last question to Khalid bin Islam. What is the main difference between the periodontal tissue in implant and in tooth?
The implant is the difference between periodontal tissue and the implant. There are many differences. Implant is a graft or insert set firmly or deeply into the alveolar process that may be prepared for its insertion. And periodontal tissue is a living tissue and gum tissue of our oral mucosa. Implant is a.
I wanted like, is there any structural differences in the periodontal structures around an implant and tooth? Is there any structural difference? Like, what about the periodontal fibers, periodontal ligament? Is there any periodontal ligament around an implant?
Implant is a artificial prosthetic.
Okay, I think, thank you. My thanks to all of the judges present here and to our Honorable Sir, Professor Abul Kalam Joarder Sir, and to Anupam Podder. I think my questionnaire ends here. We hope to see you again. Thank you. And thanks to Oishi for being a good presenter today. Thank you.
Thank you so much, Dr. Fuad Al-Hassanat sir, for your valuable comments and words for us. And we are ongoing our question answer session today. So I would like to call Dr. Maisie Elazar ma'am for this question answer session with the presenters. Dr. Maisie Elazar ma'am.
Yeah, thank you very much, and thank you for the presentation. Malia, thank you very much for your lovely presentation, very clear. I was very happy that you presented. For me, as an English speaker native, it was very clear to hear it and very understandable, and I can see from your presentation you understand what you talked about. Now, one thing I want to ask you, you mentioned only peri-implantitis, right? But there is another disease for peri-implant disease. There is two peri-implant diseases. One is peri-implantitis, and the other one?
Peri-implant mucositis.
Exactly. And this is very important to mention because peri-implantitis is not happening by itself, okay? It starts as a progression of peri-implant mucositis, and then the bacteria, of course, leads to the degradation of the bone. There is another, and then there is, of course, continuation, and at the end, the bone loss around the implants, and at the end, implant loss. So that was very, very important to mention it when you mention peri-implant diseases, okay? So yes, thank you very much for your answer. Rakib? Okay, Rakib, are you there?
Yes,
great, thank you for the presentation. I hope that next time it will be more clear because technical problem can always cause some problems, and then I lost it during it was a problem for me to hear and to understand. But nevertheless, I would like to ask you about the abutment. And I want to know if you know abutment that can actually help tissue integrity and also helps implant integrity. If you know some abutment like that and how it goes.
Implant integrity.
Integrity and tissue integrity. Maybe you don't know it, but I want to know. If you know, say the name. If not, I will tell you the name, and maybe you can explain me the advantages of this abutment.
Integrity means this concept, I'm not clear, but I want to tell you something. Integrity means bones, tissue, and within the soft tissue, abutment and bones, like migrations or fixture.
Okay, Rakib, do you know platform switch phenomenon, platform switch abutment? Do you know this? Do you know this abutment? The platform switch abutment. Do you know this kind of thing? Do you hear about it?
Yes, no, abutment, what is this? I know.
No, I'm talking about the platform switch.
Platform switch.
Yeah.
No, ma'am.
So, okay, no. Okay, just for you. Okay, this is an abutment that it's actually what the connection to the implant is the diameter is smaller. And why we're doing it? Because the tissue is coming above the implant and the connection is farther away from the bone. That means the bacteria is not in the connection between the continuation of the abutment and the implant. Okay, so if you looked for platform switch, okay, and then you will see how it looks, and you understand why today most of the abutments that we are using, we're using platform switch abutment. Okay.
Okay.
There is less bone loss around those implants. You're welcome.
Yes.
And Kalib,
I will try my best from next time. And thank you, ma'am.
Thank you. Thank you. Kalib, are you there?
Yes, madam.
Okay, so thank you for your presentation, as well some technical problem, but I guess this can happen. I want to ask you something. I started with I mentioned before about peri-implant mucositis. Okay, I want to ask you, can peri-implant mucositis be resolved? Can you treat and resolve this disease of peri-implant mucositis?
Yes, madam.
And how do you do that?
First, the implant. First, I can use non-surgical therapy for peri-implant mucositis. Then I use curators and ultrasonic devices, air abrasive devices or lasers, with or without use of local antibiotic or antiseptics.
Okay, so you will use the ultrasonics that you use around teeth, you will use it around the implants for peri-implant mucositis.
Yes, madam.
So I want to tell you that it's a no-no. Why? Because you have the ultrasonic, which is a metal. And if you touch this metal with titanium or with the implant, you will scratch the titanium, or you will scratch the abutment, or you will scratch the crown. And at the end of the day, you will gain more bacteria. So in order to clean around implants, you will have to have a special tools. Okay, this is not the same tools like around the teeth. This is tools, for example, you have titanium curettes, you have, sometimes you have titanium tips, of ultrasonic tips, but not the regular one, okay?
Yes,
I
madam.
am specifically use laser around implants with soft tissue curettage because we're not allowed to touch the titanium implant. Anyway, if I'm talking about peri-implant mucositis, that
Yes,
means
madam.
there is still not a bone loss, okay? So around those area, if you have an inflammation, you can use the laser, or you can use, yes, antiseptic, or you can use all of the above, or together with titanium curettes or plastic curettes, okay? Something that will not scratch the implants. Now, if you would like to see, all of you, if you like to see my technique that I'm doing, what the Switzerland technique is, you can go to Perio Home, one word. I also wrote it in the remarks in the Zoom. I have a YouTube channel which demonstrates a lot of the procedures. And one of the procedures is how to treat peri-implant mucositis. Okay?
Yes,
And
madam.
also on my website, so you can learn about it a bit more.
Thank you, madam.
Because one, I think about now it's a remark for all of you. One of our goals as a dentist, now that we have this, I call it the pandemic of peri-implantitis and peri-implant mucositis, all the disease around implants, we need to treat it. And if we treat it wrongly, we will cause damage. And this is part of what I see in my clinic. So we need to know what we are doing. And so that's it.
Thank you so much.
Thank you, all of you, and thank you for participate.
Thank you, ma'am.
Thank you.
Thank you, ma'am.
Thank you so much, Dr. Maisie Eliza, ma'am, from Switzerland, for sharing knowledge with us and making us enlightened with her knowledge. Thank you so much, ma'am.
Thank you.
Now, I would like to call Dr. Anurag Satpathy, sir, to say something about this question answer session and to talk to the presenters. Dr.
Thank you,
Anurag Satpathy, sir.
Hello. Yeah. Thank you, Aishi. You have been a wonderful moderator today.
Thank
At the outset, let me thank the organizers, Dr. Anupam Podder, the chairperson, sir, and our guest from the Bangladesh Society of Periodontology. It was a wonderful session. Especially when, as Dr. Fahad Al Hasnat was saying, that not much implantology is being done in Bangladesh. However, in spite of the technical issues, you have been able to speak good knowledge and present. Now, coming to, and thank you, Dr. Maisie, for your wonderful interaction and your channel. It's a wonderful channel. Thank you for sharing your knowledge. Maliha, you have been, your presentation was very good. You are very confident and the content was excellent. And it is very nice to see that you are presenting with such confidence on a topic which is very widely used today. Implantology is the center of dentistry in today's times, and recently in 2017, the classification has now adopted and incorporated peri-implantitis and peri-mucositis in its classification. That amounts to show how much importance the Periodontal Society is playing, giving to implantology, because we still feel that unless we have the mucosa and the peri-implant tissues of health, the implant too will not survive. If the tooth cannot survive, the implant will also not survive. Okay, I want to ask you a few questions, if it is okay. Maliha, can you tell me about some of the implant surface designs that are being now used? Are you aware of that and its advantages?
Thank you, sir, for your question. Implant surface design, sir.
Yes. You see, now there are many kinds of implants which are available, right? A lot of companies are there, a lot of implant systems are there. So can you share some knowledge on what are the various types of implant surface which are now being put into practice? Okay. Have you heard
I'm
about
sorry,
it?
I cannot remember.
It's okay. It's okay. Have you heard about the active implant systems or SLA surfaces? Have you come across these terms?
No, sir.
Okay. You see, the basis on which the implant survives is the primary interaction with the bone around the implant and the implant surface, right? So in order to have a good interaction, we need that the bone, the blood around the implant should come in as much contact with the implant surface. That is the reason why we are turning the surface into various types. We can make it rough by means of sandblasting. We can acid etch it. Okay, we can surface treat it in order to increase the surface area and thereby increase the contact. And once that is done, there will be more and more interaction with the osteoblast cells and the implant surface, which will amount to a better osseointegration. And as you know that we want osseointegration, that is the pillar of success for a successful implant, right? Okay, fine. I think it was a little too much for the question for you, but your presentation was good. Okay. Can you also tell me about how would you treat a case where there is insufficient bone and you want to place an implant?
Sorry, sir?
If you have a case where there is insufficient amount of alveolar bone and you want to place an implant there, how will you go about it?
For her defense, I'm not sure dentists know that so much. So also the last question was for her defense. I know dentists that doesn't know the different types of surfaces. They just put implants, but without a lot of knowledge.
Dr.
So.
I think, yeah, there still, like I told you, dental implant is just being incorporated, and probably due to pandemic, they haven't studied it yet. They just prepared for 2 days, and lots of things are there to teach them, which is probably postgraduate sometimes. So Yeah, I think they're trying. Thank you. So you can drafting procedure. I think they will understand if you share some knowledge with us today.
Yes, yes.
They can learn, and also the students who will be watching this program would learn more. Okay.
Yeah, especially doctor, for because implantology, as Dr. Maizi was telling, that they feel that it is just about opening up and drilling and placing a metal insert, but it is much beyond that. And
Yeah.
hopefully, as we have been progressing, we also learn the right techniques, the right science behind that. And I'm happy that students have taken up this topic and they have shown their interest. Maizi, Maliha, you have excellent presentation. Don't worry about the questions. Okay.
Sorry, sir, I cannot answer.
It's okay. You can also tell me about some of the. Have you heard about sinus lift?
Yes, sir. For maxillary tooth, we have sinus lifting procedure.
Okay. Okay. Very good. Very good. Thank you. Then we have Rakib. Yeah. How are you? Fine with your.
Alhamdulillah, sir. And you, sir?
I'm fine. Thank you. Okay, wonderful. You managed with your presentation well. You started with a wonderful car, and it was a good presentation, Rakib. Can you simply tell me why do we use titanium as a metal in implantology? What are the advantages?
Advantage, sir, titanium is the best material in dental implant. 99% use in dentistry as a dental implant. Because it is within the bone is very good for the patient and masticatory force very important, and it's gave as really good aesthetics and strength and stability is very good.
Okay, why don't we put iron, and why titanium? What is the difference?
Okay, this is metal or titanium.
Oh, you can put iron, right? But we don't put iron, we put titanium because it resists, it has a good corrosion resistance. It is very light, it is very biocompatible. Okay. The oxide layer which is formed, it is very helpful for the passive layer, and it interacts and helps in osseointegration. It can also take up repeated stresses because of the masticatory forces. Fine. And a special kind of alloy is used in titanium, which is the alloy which is world over used. Anywhere you go, any company, any implant, either you use in dental implants or prosthetic implants or orthopedics, they use titanium for these reasons. Okay. Yes, good. Okay. Then yeah, Khalid, are you there, Khalid? Yes.
Yes, sir.
Okay, good. Good. You also overcame the technical glitches. Good. Excellent. Very good. Will you be able to answer a few questions, Khalid?
Yes, sir.
Oh, sure. Okay, just tell me if you have come across these terms called immediate and delayed implants, immediate and delayed loading. Do you understand this? Have you come across this?
Immediate implant or delayed implant?
Yes.
Immediate implant.
Okay, one stage, two stage, can you explain?
Difference.
Yes.
I answer difference.
Okay.
Immediate implant is when an implant placed at the same time as the natural tooth is extracted.
Very good.
Implant placement in fresh socket was
very
first.
Good.
This is immediate implant, and delayed implant was when we use delayed implant when we placement and loading has its consideration as well as by insertion. That was not the same day as implant insertion.
Okay. Okay. Very good. Very good. Do you know about screw retained implant and cemented implants? Have you come across these terms?
Yes, sir, of course. Yeah, screw return implant is one type of screw. Screw return. It is
What
a
part? What
it is
part
a
of the
placed
implanting?
lingually. Screw return implant is placed lingually to allow screw emergence through the cingulum area. In
Okay,
anterior
very good, very good, very good, very good, very good. Fantastic. Thank you very much. Yes, Dr. Anupam, it was a wonderful. Yeah. Thank you again, and thank you for Anirban sir also for this opportunity. All the best, students. Wish you best of luck.
Okay.
Thank you so much, sir, for your valuable comments and words. Now, I would like to call our next judge, Professor Dr. Anirban Chatterjee, sir, to say something and to continue the question answer session with our presenters. Professor Dr. Anirban Chatterjee, sir.
Sir, please unmute yourself, sir.
Sorry. Thank you, Anurag. Now, I have a question for Maliha Mazhabin. What is the treatment for peri-implantitis? Already, Dr. Mezi has already spoken about perio-mucositis, but what is the treatment for peri-implantitis? According to you, what would be the best treatment?
Sir, can you repeat the question?
What is the treatment for peri-implantitis?
Sir, we can do non-adjunctive surgical procedure like we can do laser treatment also.
No, other than laser, can anything else can be placed there? Other than laser.
I can answer this.
Sir, photodynamic or something like that.
Photodynamic and laser almost comes to be a similar thing. Okay. Anything else?
Sir, diode or something laser like.
Laser. No, laser other than laser. Laser is one of the treatment aspects. Other than laser, what is the other things what you can place or what you can do once you see there is a peri-implantitis case?
Sir, and antibacterial or antiseptic?
Some
Very
local
good.
delivery, you can go with oxygenated thing like now that is blue M gel is there with oxygen gel, which is very effective in the treatment of peri-implantitis. And preferably my always a preference had been, and I have been working with that for a pretty long time, is what we call it as PRF membrane and like sticky bone. I don't know, it might be a little on a higher side for yourself, for you people, but generally I've been placing sticky bone, that is what we call it as liquid PRF, injectable PRF mixed with bone graft and PRF membrane. You can just go for PRF, but sticky bone would be ideally because it releases a lot of growth factors more than PRF, plus the bone graft which stays for a pretty long time. The result has been very good with that. And as Mezei has already spoken, that you should not use any steel, I mean the scaler, normal scaler, it should be a titanium curette or Implacare. Hufredi company has a Implacare, a plastic titanium and plastic instrument to remove all the peri-implantitis tissues all around. Okay, second question would be, we were speaking about osseointegration, right?
Yes, sir.
And can you tell me what is the latest term of osseointegration? Osseointegration is a older term. Now, what is a new term? The new term is biointegration. New term is
Biointegration.
biointegration.
Okay, sir.
Yeah. And and it's a general question for any three of anybody can answer. See, around the tooth, we have GCF, gingival clavicular fluid. Around the implant, what do we have?
So please repeat the question. I can help.
Okay. Okay, I'll ask Khalid only. Khalid, what if around the tooth there is GCF, gingival clavicular fluid, around the natural tooth? What is the liquid or fluid known as around the implant? Anyone? Anyone? Anyone of you?
Gingival clavicular fluid.
No, gingival clavicular fluid is around the tooth. What is the fluid known as around the implant? It is peri-implant fluid, PIF, peri-implant fluid. Okay. And my last question
Yes,
to Rakib, I'll ask. What do you place before you? I mean, what is it known as before you place the abutment?
Yes, sir. Can you repeat this question, sir?
You mentioned about the gingival former, right?
Yes, sir.
What is the other name for gingival former?
Gingival former, another name. Can't remind it, sir.
So I can answer.
Yeah, please.
The healing cap.
Yes, healing abutment.
Healing cap.
Healing abutment or the healing cap. Okay,
Healing
fine
abutment.
enough. I think everything has been discussed. It has been a good presentation. Might be due to some technical problems. Khalid and Rafiq had some issues. Fine enough. And this being the last of your paper presentation. So from last 2 months, I have been there for almost 5 or 6 of the your paper presentation. So it's been a wonderful going through all the sessions, whichever I have been there. And few I was not judged, but still I was present in that. It was a great initiative taken by Dr. Anupam Podder, and he has been doing it with the Access Dental, who is been forefront, like stood in for a perio, especially the perio. One thing is always there. World over, we have seen periodontists are the best implantologists. Because I'm not telling because myself and Anurag and Maisy are the periodontists, but we know the tissue better than anybody in dentistry. That is my say, and all over world wide over also, because to deal with peri-implantitis, we are required to deal the healing of the tissue, the management of the tissue is what we deal with. So it is a very good opportunity that in Bangladesh they are starting with the perio. They're taking up with the perio subject as a whole and trying to incorporate in a better way. There are a lot of people who are involved in this, and being students, I think it is good that you people have taken the initiation, and you are now. It will be a good opportunity for you people to also learn a lot of things. So thank you everyone for calling me as one of the judges, and it is a great opportunity to be with all of you. Thank you very much.
Thank you, sir.
Thank you so much, sir, for your valuable comments and sharing knowledge with us. Now, I would like to declare that our chairperson, Professor Dr. Muhammad Abul Kalam Joarder, sir, is sick, so he had to leave. So I would like to declare our new chairperson, that is Professor Dr. Anirban Chatterjee, sir. He would be our new chairperson for the rest of the time. And now I would like to call Professor Dr. Anupam Podder, sir, to share some words with us.
Thank you, Oceanjum, for your nice moderation of today's session. First of all, I would like to thank all of our judges, Professor Dr. Anirban Chatterjee, sir, Professor Dr. Anurag Chaturvedi, sir, and Dr. Meji, ma'am, for giving us your valuable time with us. All of you know that the participant of today's session is our undergraduate student. They know about the dental implant little bit, not fast. So if any problem, any mistaken, please pardon to us and our valuable judges. They know very much about the dental implant, and I think the today's discussion it is clear to our student and also our viewer who are seeing the presentation online. So I am very grateful to the accidental school. They they are working very much, working hard in the last 2 months. This is the 16th session and this is the last session. And our next session will be our result giving session. It will be happen within short period of time, and 16 best candidate, best presenter I will select, and then I also selected the moderator, best moderator of this 16th session. So I would like to thank to our guest, Professor Dr. Zahid Sari, not here today because he has a program in Nazran University, so he cannot attend with us. He said to me, pardon me, and I will in the next session, in our result giving session, and I will thank to Dr. Milon, and also thank our previous chairperson, Professor Dr. Abul sir. He is our mentor. He is the first periodontist in Bangladesh. He is the ex head of the Department of Periodontology and Oral Pathology at Dhaka Dental College. I give him thanks to attend with us as a chairperson. Now lastly I would like to thank our current chairperson, Professor Dr. Anirban sir. He is the President-elect ISP, Indian Society of Periodontology. He will take over the charge in this month, 23rd and 23rd October. I congratulate sir, and hopefully he is very much helpful to our periodontist. He is trying to develop our periodontology in Bangladesh, and Professor Dr. Anurag sir also helping us, and I propose to our foreign judge, Dr. Meji ma'am, please help us to develop the periodontology in Bangladesh in your as if you help us, then it will be we will continue our session and in different sessions like public awareness program, that is student awareness program, that is our general dentist awareness program. So I would like to thank all of you and see you again. Thank you. Hello, Dr. Mehdi ma'am.
Yes,
Please
I'm
say
here.
something. Please say something
Okay,
about the program. Yes.
Okay, so I was very pleased to see that you are encouraging your students to have those kind of presentations. Maria made a very nice presentation and was very clear, and you can see that through the presentation, she learned a lot about the dental implant. So the program is encouraging the student to learn better. And for me, of course, I would like to see those students face to face, but we can, because when you see the student face to face, I believe he cannot search the Google to see the answer. He needs to understand. And once you understand, once you know the knowledge, once it's in your brain, nobody can take it from you. And you will be able to be the best doctor you can for your patient. So my thinking always, when you have the knowledge, you have the power. When you have the power and you can treat better your patient, you can become a better doctor. And I really hope to see more and more presentations like that, which I can see that the student understand what he say and understand the knowledge that he is gaining from this presentation. So I'm very much happy to see that you're encouraging your students to do that. This is a part of education, and I'm very pleased to see all of you here because you're taking a valuable time from your free time just to hear those students and give them a bit more of what you as a doctor have inside you so they can know better for the future. So it's lovely to see.
Thank you, ma'am.
And of course, I'm welcoming all of you. Yes, I just want to say that I'm welcoming all of you to see my periohome.com, which is my website, or to subscribe to the YouTube channel, which you can see surgeries, how they perform. It's a high quality videos, step by step, including recession coverage, peri-implantitis cases, peri-implant mucositis with laser, implants, of course, step by step, how you make implants, crown lengthening, everything that periodontist needs to know. And of course, dentist needs to know in order to tell it to his patient what he can, how can it be treated better, what are the options of treatment for him.
Thank you so much, Dr. Maisie Eliza, ma'am, for sharing your valuable knowledge with us. And we will obviously review your channel, and I hope we will get some knowledge from there too. Thank you so much, ma'am, for joining us.
Thank you for inviting me.
Now I would like to call Dr. Ankita K. Kotecha, ma'am, who was with us throughout this program. Dr. Ankita K. Kotecha, ma'am, MDS Periodontics Gold Medalist, Dental Studies Simplified. Dr. Ankita, ma'am.
Hello, namaste. Thank you for allowing me to join this meet. It was indeed a wonderful session. All the presenters almost tried their best to present the given data. And I think the judges have already done their wonderful job by giving the knowledge from their end as well. So all in all, a very interactive session. And I personally learned a lot from here. So my only request to Axis Dental School and Dr. Anupam Podder sir and their team to please continue such sessions so that we keep learning from here. Okay, and all the best to all the presenters. Keep doing better. Okay, there's always a little scope of improvement every time, right? So just continue learning and do better and better next time. Okay, thank you.
Thank you so much, Dr. Ankita K. Kotecha, ma'am, for sharing some words with us and for joining us throughout the session. Now, I would like to call our valuable honorable judge, Dr. Anurag Sapati sir, to say something about this session and share some words with us. Dr.
Thank you.
Anurag sir.
Yeah, thank you, Oishi. I think we have interacted quite a bit, and all the judges and seniors have
Yes, sir.
spoken well. One thing is that it's great to see that students are interested to come forward and present. And the idea behind asking the questions on a higher note was to inspire them to go ahead and take a step ahead. So because implant science is what today is exploding and expanding like anything. Each day there are thousands of articles which have been published, and everyone is researching on this. There are companies which are coming out with new designs. There are companies which are coming out with new ideas, so that we get better and better. There was a time when we used to tell people about root canal, that you please do root canal, and they would frown. But today root canal has been a very accepted notation. Although implantology has been there for over 25-30 years, but slowly and slowly we are seeing that the acceptance level has increased. Now patients do not frown on when we give them the option of implants, and that is the reason this is expanding. There are more and more dentists which are coming forward, and the scope is huge. Like when there is deficient bone, we can go for microvascular surgeries, we can reconstruct the mandible, we can place zygomatic implants, we can do sinus lifts. There is so much and so much to explore. And dentistry, starting from the periodontists who understand the mucosa and the bone better, the prosthetic dentist who give us the occlusion, and the oral surgeons who come and help us in situations where we require major surgeries. So it's a team effort which is driven by ultimately we are giving a prosthesis to the patient. And as Dr. Maisie was saying, she has a wonderful channel. I was just going through that. Wonderful surgeries which you can see and learn. And once you see those surgeries, it is learning is believing. So I encourage you to spend some time, and these simple questions that we are asking would be very easy. In today's term, the learning is beyond textbook. Learning is beyond person. Learning is driven by what you want to learn. And you have the internet, the Google, the YouTube, the Facebook with you. You type in a word what you want to learn and you will get it. And if you are interested to learn, there are people who are interested to teach you. So please go ahead, take that step. And I really appreciate Khalid, Rakib, and Malia. You are all winners. And I'm very sure that you are going to be very successful in your endeavors. And this is a presentation which is crossing borders. Believe me, this will be on YouTube and people will see it. And you are going to be heroes. Okay, all the best. Thank you, Anupam sir. It's a wonderful being associated with you. This is the third session which I've been associated, and each time I'm getting encouraged. Today Zahid sir was not able to come. Otherwise, it's a great learning again. And with Anirban sir and you and your ever smiling face, it's a great encouragement. Thank you again, sir.
Thank you, sir. Thank you.
Thank you so much, Dr. Anurag Satpathy. Thank you so much, Anurag sir, for sharing your valuable comments with us. Now, I would like to call our new chairperson, Professor Dr. Anirban Chatterjee sir, to say something about this session. And yes, this would be the conclusion of today's session. Professor Dr. Anirban Chatterjee sir.
Thank you. Thank you. It is an honor and privilege because Joarder sir is not well to conclude the session. My only conclusion would be it was a wonderful session we had, not only today, all the 16 weeks, what went through. It went through very fast. Hopefully we again recoup, might be after a month or something, and then again they restart with the program. And anyway, whenever I'll be coming there over to Dhaka, might be sometime soon, then we can discuss a lot of periodontal implants, especially. And with this, I just want to conclude that it's the last of the session today, and it was a wonderful learning process. I also learned so many things from Anurag, from AZ, from the speakers themselves, because Anytime it's a learning. Knowledge is never deplores. It is always increases with each session, with each day. You need to learn, learn, and learn. Learning never stops till death. So every day, every point I'm learning. I know might be a very few things in perio and implant, but whatever knowledge I have, might be I want to share with others so that the knowledge increases. So with these few words, I would like to conclude today's session. And I would like to thank the Axis Dental for giving me this opportunity, and especially Dr. Anupam Podder, a dear friend of mine, who is the flag bearer at present of perio in Dhaka, taking it forward, because with his help and Kabir, Milon, and Joarder sir and Zahid sir, now the perio subject, as I told you earlier also, it has come a long way. It is reaching some point. Thank you. Dhonobad. Shubharatri. Namaskar.
Thank you, sir.
Thank you so much, sir. Thank you so
Thank you,
much.
sir. Good night to all.
Good night.
Thank you. Good night.
Thank you.
Thank
Thank
you
you,
all.
Oji. Thank
And
you all,
I would like
presenter.
to, yes, sir. Yes,
Close
sir.
karo. Okay.
Okay, sir.
Okay.
Yes, sir. Yes, sir. Okay, this is the finishing of today's session, and I would like to tell you that we would be disclosing our winners from the episode 16 winners will be disclosed soon with another live session. And I would like to invite you all to that session. And I would like to take the permission to finish today's session. And from you, judges, Chairperson, Dr. Abul, new Chairperson, Dr. Anirban Chatterjee sir, and Anupam Podder sir. Good night to all, and stay safe, stay healthy. Okay.
Thank you very much.
Thank you, ma'am.
Thank
Good
you.
night. Good night.
Good night. See you soon.
Thank you, Ankita. Good night.